Hey there, fellow YouTube enthusiasts. Today, we are diving into a topic that's both crucial and often overlooked: childhood vaccination rates. Now, you might be thinking, sure, vaccines are important, but why all the fuss? Well, let me tell you, it's not just about individual health, it's about the collective well-being of our communities. So, grab a seat, and let's explore the fascinating world of childhood vaccinations, the challenges they face, and the innovative strategies being employed to tackle them. Personally, I think the way we approach childhood vaccinations is a microcosm of the larger healthcare landscape. It's not just about the vaccines themselves, but the complex interplay of factors that influence their uptake. From the individual level to the global stage, there's a lot going on, and it's fascinating to see how these pieces fit together. Now, let's break it down. First things first, why are childhood vaccinations so important? Well, in my opinion, it's all about the power of prevention. Vaccines are like the body's own superhero team, fighting off infectious diseases before they can take hold. Think of it like this: measles, polio, tuberculosis, and hepatitis are some of the villains in this story. Now, imagine a world where these diseases run rampant, especially among children under 5. Their immune systems are still developing, making them more vulnerable to these threats. So, by vaccinating our little ones, we are not just protecting them, but also creating a shield that safeguards the entire community. It's a shared responsibility, and it's crucial for their right to health and well-being, as reflected in national and international commitments. Now, let's talk numbers. According to the latest global estimates, about 85% of infants worldwide received all 3 DTP doses. That's a pretty impressive stat, but it's not the whole story. Approximately 13.5 million children were classified as zero-dose, meaning they hadn't received the first dose of a DTP-containing vaccine. So, while we are making progress, there's still a significant number of infants who are missing out. Now, you might be wondering, what's stopping these kids from getting vaccinated? Well, the answer is a complex web of factors, and it's fascinating to see how they all interconnect. At the household level, we've got caregivers who might struggle with transportation, the cost of seeking services, or work responsibilities. These are the everyday challenges that can make it difficult for caregivers to access vaccination services. Then, there's the community level, where local beliefs and attitudes play a significant role. Some caregivers might prefer traditional healing approaches, or might wish to try them before seeking vaccination. It's a delicate balance, and it's fascinating to see how these cultural and social factors influence vaccine uptake. Now, let's zoom out and look at the bigger picture. We've got health facility or healthcare level barriers, like vaccine stockouts, understaffed clinics, or long wait times. And then, there are broader health system factors, such as limited funding for healthcare, and access barriers like rough roads, underdeveloped infrastructure, weather, or conflict. It's a complex puzzle, and it's fascinating to see how these factors all come together to create the challenges we face. Now, here's where things get really interesting. Our investigation identified 4 distinct types of strategies that could help improve vaccination uptake. These strategies are like the building blocks of a successful vaccination campaign, and they each have their own unique role to play. First up, we've got demand-level strategies, which target caregivers and communities to increase uptake. Examples include sending text reminders about upcoming appointments, or educational sessions on vaccination benefits. Then, there are service delivery level strategies, which focus on how and where vaccination services are provided. Mobile vaccination clinics and communication training for healthcare workers are some of the tools in this category. Next, we've got system-level strategies, which address things like structures and systems. Enacting a policy that links vaccination status to enrollment in childcare or kindergarten is a great example of this. And finally, we've got multi-level strategies, which combine different types of strategies to create a comprehensive approach. For instance, a strategy that combines text message reminders with healthcare workers who can download a mobile app to schedule appointments and track vaccinations. Now, let's talk about the impact of these strategies. In Canada, one study conducted in Saskatoon reported an increase in MMR immunization coverage of approximately 7 percentage points following telephone reminders. The offer of home visits was also associated with higher coverage, although the effect wasn't statistically significant. This approach may be particularly relevant in Canada because telephone access is quite widespread, and home-based services can help reduce access barriers for some rural, remote, and underserved populations. Internationally, several strategies showed promise. Cash incentives produced small, but consistent improvements in full vaccination coverage, although evidence came from only 2 lower middle-income countries. Informational sessions also improved coverage for later vaccine doses, but results varied across studies, making the overall size of the benefit uncertain. Now, here's the fascinating part. No single strategy worked the same across settings. The effectiveness of these strategies depends on the context and the barriers or needs of that population. Now, let's look at the future. Are there any newer strategies that have yet to be tested, but could prove more successful? Well, that's where my current study in the East African context comes in. Participants have shared examples of strategies, including digital tools, to strengthen vaccine communication and decision-making. For instance, in Kenya, they have a rumor tracking tool that looks at social media messages. This tool was first introduced to track information gaps and respond to misinformation about COVID-19 vaccines. Digital tools could also support the tracking of highly mobile populations, improve information sharing across different levels of the health system, and allow data to reach decision-makers more quickly. Another opportunity involves co-designing strategies with caregivers, communities, and healthcare workers to ensure that the strategies respond to local needs and fit the local context. It's all about finding the right balance and tailoring solutions to the unique challenges of each community. Now, how can our findings be used to improve vaccination coverage rates? Well, first, we need to prioritize further evaluation of strategies with the most consistent evidence. Second, the findings can help programs match the strategy based on the reasons why children aren't being vaccinated. And third, the study helps position the next generation of research. The main message isn't really to copy and paste one intervention, it's to use the evidence to select an approach that matches the local needs, resources, and challenges. It's a delicate dance, and it's fascinating to see how these strategies can be adapted to fit the unique needs of each community. So, there you have it, folks. Childhood vaccinations are a complex issue, but with the right strategies and a bit of innovation, we can make a real difference. So, let's keep the conversation going, and remember, every little step counts in the journey towards better health for all.